Welcome back, everybody. Dr. Schlesinger with Legacy Neurology, or Neurosurgery, is here to talk about how neurosurgery and spine problems can be related and how new technology is being used to help you. Dr. Schlesinger, great to see you as always, sir. Thanks for coming in today. Let's open up with about probably neurosurgery and spine problems. You talk about how they're connected. How exactly does that work?
Well, that's a great question. Many people think when they hear neurosurgeon, that's the brain surgeon,
yeah.
and that's a large part of what we do, particularly in our early years in training. Are taught to train and learn the microscopic anatomy and surgical conditions of the brain. Spend a lot of time on that. It's the hardest, most challenging area in surgery. But also spend quite a bit of time in the spinal, on the nerves of the spine and the spinal cord and peripheral nerves, so nerves in the body. So everything's connected back to the brain, and that is how we get involved and are intimately involved, is that there's a pathway that starts up here in the brain and goes down to your hand or down your leg. And so the problem really can be anywhere along that path. And our job as neurosurgeons is to know where it is and how to fix it. And where neurosurgery blends into the spine, there's a lot of people have mistaken concept that, oh, well, if you've ruptured a disc, that's a orthopedic problem or whatever.
Yeah,
and
that's a good point.
And what does it have to do with neurosurgery? It does have to do with neurosurgery if it affects one of the nerves going down your leg or down your arm, or pressing on your spinal cord, causing dysfunction of the spinal cord itself that controls the arms and legs. So that's where we become involved and our fields overlap. But our approach is more towards the nervous system and the effect on the nervous system from a ruptured disc or a broken vertebra, in addition to problems in the brain.
Interesting. What is MIS?
Well, MIS is a new concept that is also fits quite well into neurosurgery, and that's the concept of minimally invasive surgery or minimally invasive spine care. And the concept is, how can we take and provide the least invasive procedure to a patient with a particular problem that has a reasonable chance of solving the problem. So instead of destroying a whole foundation of a house and rebuilding it from ground up, how can we go in through a small window, fix the actual problem, and then get out to provide the patient with the resolution of the problem, but the least amount of side effect, the least amount of time down, the quickest return to life, the least amount of pain, blood loss, and risks of all sorts, infection risk, etc. All risks are that we know of are minimized when you do the surgery through a minimal approach.
We saw a slide just a moment ago where it kind of illustrated just that one little square. Can this be done as an outpatient surgery?
Yeah, this is the exciting transition. You know, when I first started residency in Dallas, we admit patients to the hospital about a week before, make surgery, and then they discharged about a week later. And now, you know, the majority of what I do is totally outpatient, and it's really gotten exciting in some of the new developments even in lumbar fusion surgery, decompression and fusion surgery for slip spine or spondylolisthesis patients. We're able to free up the pinched nerve, which is the real problem, but it's caused by the crack in the foundation. And we're able to do a lumbar fusion and decompression all through a very small portal and with a thimble full of blood loss and very little pain, and do it entirely outpatient now.
Kind of remind everybody where you guys are located and how they can call, set up an appointment, or set up something where they could get an outpatient procedure. Where are you guys located at?
Well, certainly they can get reviewed for what is most appropriate, whether it's a surgery or just therapy. Or we're at Pavilion in the Park is our main office, and it's legacyneuro.com is the best way to reach us at the website, www.legacyneuro.com. Or contact us at legacyneuro.com.
Perfect.
Or certainly call us.
Well, that is a great idea for people out there who might be experiencing some pain in their back. Not always orthopedic surgery or orthopedic help, like you said, could be linked to their brain. So we appreciate all the work that you guys do over there. And thanks again for coming in and kind of explaining all the new technology that's available out there today.
Thank you.
All right, coming up next.